from Liberty Family Practice.
Yep.
And she is a family practice physician, and she's going to be talking to us tonight, so please give her your attention.
I'm not sure exactly what, give me an idea, what, have you guys had other doctors come and talk, or
Yes, from different subspecialties.
are there certain things you like to hear more about? Just kind of life story, how I got where I am and what's going on.
Yeah, well, do you want to do a real simple introduction of yourself? We can all go around introducing ourselves and what interests we have in family medicine or what we want to
Yeah, kind of give me an idea of what you're interested in. Everybody's pre-med in some sort of thing. Okay.
You go first.
I'm probably pre-med. And you're actually prenatal, but I guess know more about how to practice in general.
Okay. What year are you guys different?
Yeah, I'm a junior.
Okay.
I'm Hannah Oakley. I'm a doctor's assistant, and I actually want to go into midwifery at some point. So.
I'm Brendan Smith. I'm actually a foreigner too. I'm from Connecticut, and I'm a junior, and I'm interested in family medicine and possibly pediatrics. I don't know.
Okay, I'm Jeremy. I'm actually a freshman, and I'm not sure. I want to do something like in surgery, but I'm not quite sure right now.
You're next.
Oh, okay. Is that right? I'm Rick McKnight. I'm the webmaster. I'm interested mostly in surgery, but I'm pre-medicine. So.
I'm Parker Northrop. I'm a sophomore. I'm interested in either sports medicine or family practitioner. So.
Brian Sutter. I'm a sophomore in sports medicine.
I'm Chelsea Sugars. I'm a junior. I'm in Augusta, Georgia. And I'm interested in a lot of things, including family medicine.
I'm Jennifer Ron. I'm a senior, and I'm interested in pediatrics.
I'm Nick Boyer. I'm graduating senior, and not really sure what specialty yet. Just something.
I'm Rebecca Covington. I am interested in family medicine or pediatrics. I'm not really sure something along these lines. I'm a junior.
I'm Amy Reeves, and I'm a junior, and I'm just keeping an open mind to all specialties.
But you never know what's going to happen. Well, I'm Lori, and like I said, I'm from Ohio originally, and unlike all of you, I didn't know I wanted to go into medicine until about my 5th year of college. So I was an engineering major. My bachelor's is in electrical engineering, but I always was interested in health and healthcare or some kind of sports medicine. So my plan was to get my undergrad in engineering and then get a master's in biomedical engineering. So when I got to my senior year and started taking some biomed classes, we started going to visit the hospital. We visited the OR and learned about lasers and actually looked at the laser there. We went to some bone crushing lab and looked at the force and how they measure the bones. So I kind of got more interested when every time we went to the hospital, I was like, oh, they're doing surgery right over there. That's pretty cool. And so after I finished, I had a job actually at General Motors. I was a co-op student. So I already had a job offer at General Motors, and I went ahead and took that. And during the evenings, I volunteered at University of Michigan Hospital and kind of just got my feet wet and tried to figure out sort of what I wanted to do. And yeah, I liked it. So then I, got to go back and take biochemistry, which I didn't get to take my undergrad, and that was fun. And took the MCAT and applied medicine. So I kind of went from there. And then at that point, I was really interested in, like a lot of you are, in family medicine or pediatrics, but I liked OB too. And I had my advisor was actually a pediatrician, and I really couldn't decide because I liked every rotation. I liked surgery. Never thought I'd want to do it, but I really enjoyed it. And I liked internal medicine, and I liked family medicine. That's kind of your family medicine person if you really liked everything. And then when I liked the babies, and I didn't want to, wanted to do peds, and I wanted to do OB, and my pediatric advisor told me, well, if you like procedures, we really don't do any procedures in pediatrics. So you're not doing much cutting, but in my job, I get to cut moles off and freeze warts and pop abscesses, and I get a little bit of share of gross stuff without getting into too much. So it kind of keeps the office excited. So I finished med school, and that was in Detroit. I went to med school at Wayne State in Detroit. And by the way, if you guys have any questions, just stop and ask me. We can go off on a different tangent, that's fine. But at Wayne State, we had, back then it was one of the largest medical school classes. There were like 160 in my class. It was about 50% women, and that was in 93. I was in school from 93 to 97. So that was kind of a fairly progressive class back then. And I ended up going to family medicine, and I matched, and that's when I came to Greenville, because it was warm, and I was here in December, and there were flowers blooming, and the sun was out. And I said, well, I come back to Ohio. So during that time, I got married during med school, and we moved down together. And then, so residency for family medicine, it was and still is 3 years. And pretty much all residencies now, you talk to people a little bit older than me, and they've usually gone through like the interim year and just went a general internship and then went on and did a residency in surgery or peds or family. But most of the residencies now, if you know what you want to do in your match, you go and you are in the same program the whole time. So I was at Greenville for 3 years. And that was family medicine, and that just kind of confirmed that I liked it. I was one of the few, actually I think I was the only one in my class that decided to deliver babies when they came out. And that's actually how I ended up in Liberty, where I am now, because very few family doctors are delivering anymore. Out west, a lot of them aren't. You have to get into North Dakota, and that probably there's just not very many doctors per square foot. You'll see people even doing appendectomies and C-sections, and a lot of family doctors do. Alaska, I met a girl from Alaska, and she says, well, my nearest referral center is 250 miles away. If they need surgery, I have to get them on a helicopter. So they do a lot, some of the remote places. So I wanted to do OB. Nobody in Greenville really delivered. There wasn't anyone to share a call with family medicine. I mean, if you didn't do C-sections, which I didn't try to do, and I really didn't care to do, the options were Easley Hospital and Lawrence. There were a couple groups in Lawrence that still delivered. And Union, there's a gentleman, I think 2 people at Union still. So I actually kind of limited it to those areas. And Karen Artis, who's probably Dr. Artis, opened a practice in Liberty in '95, and she had her own business there. So I joined in with her, which was a pretty busy practice right off the bat. And we delivered, the 2 of us, delivered babies for 7 years, 8 years. And I quit a couple years ago when she retired, and just said, she got into a lot more administrative and computer stuff. And at that point, it was just so hard to recruit somebody who still wants to deliver babies. But it was wonderful. If you want to go into that, I think that midwives are kind of going to make it come back. That's just my own gut feeling of the way things are going to happen. Everything is swung to C-section, and there's been a lot of articles lately now about, doing more C-sections, and there's increased mortality to moms. And so I think the pendulum's going to swing back the other way. We did a real low-risk practice. We had a lower C-section rate in most places. But that was really rewarding, because we took care of moms when they would get pregnant. We delivered the babies, took care of the babies. I'd see an older person in the office 2 weeks later, and she'd say, you delivered my great-grandbaby the other day. And I wouldn't even make the connections, because they told me when I moved there that everybody in Liberty is related, and I figured it out eventually. And I find out still, people come in and they'll say, well, so-and-so is my cousin that comes here. So that's the kind of the neat issue. With family medicine, and you're there a few years, you get to know your patients, and you're going to find out that, you kind of know the dynamics of the family. You kind of know, well, this family has a lot of drug and alcohol issues, and I got to be careful what I give to this person, because I know the grandma's going to come steal it. Or you kind of get to know which moms never come in, family with 5 children, and you never see them except when they need shots. So when the emergency room calls and says, I got so-and-so here, they can say, oh, well, something's wrong, because they don't come to the doctor. That's the difference, I think, being a little more rural, being in some of the larger areas. Another thing that makes me a little bit different right now is I still go to the hospital. Even though we don't deliver anymore, there are 5 family doctors at Easley Hospital that take care of the babies. So there's a group of pediatricians and there's a group of family doctors. So I see most of my own patients when they deliver. My oldest child now, I found out today, is 11 that I delivered, which made me feel really old. So now I'm starting to see these kids grow up, and that's kind of neat too. You know? I took care of a couple twins. I didn't deliver them. They were about a year old when I started there, and went through asthma and ear infections, and one of them was real sickly, and then they got their 4-year-old shots, and they had one boy in one room with mom and the girl in the next room with grandma, and they were just going to get them done at the same time. We had extra nurses. I came out and I was in between the 2 rooms, and they both started screaming at the same time. I was 9 months pregnant, so I cried too. So you kind of get attached to your patients. And now the boy says he wants to be a doctor, and these kind of things. So it's real rewarding from that aspect. You know, when you develop relationships and you have people bring you a Christmas present. A nurse practitioner that works with me today, she's pregnant. I saw a baby gift that a patient brought her. So that's the good part of the job. There's a lot of bad parts. Mostly, you're going to have any job. The government stuff, disability forms, just keeping up with the things you got to do to have a business. You have to code right. You got to have certain things on the paper. I mean, it's one thing you're learning now is all the the background stuff and the med school, and it's the anatomy and pathology and the drugs, and then the last 2 years you learn how to put that together and touch patients and figure out how to take, all this overload of information that you've used and apply it to treating someone. And then you think that you're really, really smart when you're all done with that, and you get to residence and you realize you don't know anything. And then you learn, and by the end of the year, 3rd year of residence, you feel pretty smart again, and you think, man, I can do it all. I'm helping these interns take care of their patients. You come out in the real world, and there might not be anyone to talk to. So then you really learn to use the internet and use your resources and do it on your own, just like delivering babies. So it's always someone there in medical school and in residency to back you up. So you can say, well, I'm not really sure. I don't know if she's 3 centimeters or 8 centimeters. I just can't tell. It's too hard. When you're the only one, and one of the residents taught me this, you got to figure it out. You just got to keep kind of doing it. So that makes you a little bit more aggressive, just knowing that you're on your own. And then knowing your limitations. That's a big thing in family medicine. I think, obviously I can't do everything, so I have a lot of good specialists, and I have good relationships with a lot of surgeons and nephrologists, and I need to some of my people too. So I can just pick up the phone and call a radiologist and say, you know what? They've got this and this problem. I don't know if the better test would be an MRI in this case or a CT scan, and they can kind of guide me. A couple other tasks I was going to go on. Right. Taking care of people in the hospital. We take care of the new babies in the hospital. I take care of adults too. So I have a lady in this week with, she's been bedbound from arthritis for over a year. She had an infected hip, and they had to get the hardware out, and she basically can't walk anymore. And she spends most of her time on her back. And she had a kidney infection, and what ended up being an ulcer, which wasn't apparent at first. So I'm taking care of her, but I've known her for 6 or 8 years. So, even though she's got a surgeon seeing her and a urologist seeing her, I'm kind of know the history and know what works best, and she's actually looking to me. And a lot of times people will say, well, what do you think? What Dr. Carson, but like, you sent me to this cardiologist and he told me to take this medicine, but I didn't want to take it yet because I want to make sure it's okay with you. So I have to don't know. It's okay. If I send you to him, you go ahead and take what he said. But they do you get the relationship, and they trust you and respect you, and they're going to want to make sure that you look at all the medicines from everyone else, which in these days as medicines are exploding and expanding, it's pretty important. Practice. Asked about managing practice or something. Or starting one.
Yeah.
And when, that's the other thing, very few doctors now own their own practices, and I started out, and it was a private, my partner owned our building and owned the practice. Actually, we didn't own the building at that point, we were renting it, and we ended up buying it. So I worked for a year, and then I bought into her debt practice, because that's usually the way it works. And we worked hard for, probably till about 2008, and during that time,